Welcome to Justice Rounds with Dr. Jamel, where we will dispel myths, defend families, and demand justice. I'm ready if you are. Let's get started. Welcome back to Justice Rounds with Dr. Jamel, where we will dig into health disparities and demand justice in healthcare and beyond. I'm your host, Dr. Jamel. Today's episode is called Unmasking Kidney Disease and Advocating for Equity. Today, we're tackling a very tough topic for many of you, and also for me and my family: chronic kidney disease, or CKD, kidney failure, dialysis, and renal transplantation. But I'm here to empower you and your loved ones with knowledge, resources, and hope. We'll look at the latest numbers on kidney disease in 2025. I will share my personal story from my own family, and I will also address the barriers, myths, and advocacy efforts that shape the lives of millions. If you or someone you love has been impacted by kidney disease, this episode is for you. So let's get started. Chronic kidney disease, or CKD, and renal failure statistics. A closer look at the numbers. Let's begin with some sobering facts. In 2025, chronic kidney disease, or CKD, affects nearly 39 million Americans. That's about 1 in 7 adults. But not everyone is affected equally. According to the National Kidney Foundation, we see that Black Americans are almost 4 times more likely to develop kidney failure than white Americans. Hispanic and Latino communities are about 1.3 times more likely to develop kidney failure compared to non-Hispanic whites. Native American and Asian Americans also face higher risk compared to the general population. In South Carolina, the rates of CKD and renal failure are among the highest in the nation, with Black residents disproportionately impacted. This year, over 800,000 Americans are living with kidney failure, medically known as end-stage renal disease, or ESRD. Once someone reaches kidney failure, treatment options narrow to dialysis or transplantation. In 2025, around 570,000 people are receiving dialysis treatments. Of those, approximately 35% are Black, 20% are Hispanic, and the rest are white, Asian, or Native American. To put this into some context for you, Black people make up only 13% of the U.S. population, but make up 35% of patients on dialysis. In South Carolina, the proportion of Black patients on hemodialysis is even higher than the national average. Transplantation is often the gold standard treatment, but access is far from equal. As of this year, more than 90,000 Americans are on the waiting list for a kidney transplant. Sadly, the vast majority will wait years, and some will never receive the organ that they need to save their life. Black patients face barriers to access at every step of the process, and on average, wait a year longer than white patients to receive a kidney transplant. These disparities are not just numbers. They represent real people, real families like mine. My family's journey, Lennard's story. This subject is deeply personal for me. My big brother Lennard was diagnosed with kidney disease in his early 40s. Then, at the age of 45, he started dialysis. Lennard was always my biggest encourager, my biggest supporter, my biggest protector. He could make me belly laugh so hard like nobody else could. and he gave the biggest bear hugs. And he was super proud of his sister doctor. Um, he would always proudly tell everyone that would listen that he was so proud of me and proud that I was a doctor. But health wise, he struggled with obesity, with his highest weight being 465 pounds. And subsequently, he was diagnosed with high blood pressure and diabetes, all of which are the biggest risk factors for kidney disease. When Lennard's kidney began to fail and he was told that he would have to go on dialysis, he was overwhelmed and scared by the prospect of dialysis. Spending 3 times a week, at least 4 hours at a time, and sometimes longer for him because his blood pressure wouldn't tolerate, going at such a fast rate, being in a building hooked up to a machine. He felt isolated and ashamed. Our family learned quickly that kidney disease isn't just a medical problem, it's an emotional, financial, and social challenge. Lennard's journey was complicated by the very system meant to help him. Despite his resilience, he faced obstacles in getting on the transplant list, including biases about his weight and blood pressure control. But with the support of his family and a team of dedicated doctors, Lennard pushed forward. He was eventually referred to the MUSC transplant team to undergo his pre-evaluation testing. He was checking off his list, getting all of this pre-testing done until December 2020 when he got COVID. It would take him 5 long months to recover from the infection of COVID-19. He spent several weeks intubated and then was just severely debilitated after that hospital stay and had to end up going to a long-term care facility where he would go back to the hospital several times until he was finally able to go home from that long-term care facility in May of 2021. When he was finally healthy enough to restart his pre-evaluation testing for transplant, we discovered that his heart was now the hindrance. We found that out in October 2021. In February 22, my brother had 2 massive strokes that left him paralyzed. He had always told us that he was not going to be a burden to anyone in the family. So in March of 22, while still hospitalized, he made the decision to stop dialysis. My brother, Lennard, passed away peacefully in the Hummingbird room at a hospice house on March 9th, 2022. His story, my family's story, is a reminder that behind every statistic, there is a person. That person for me is my brother. And he was a son. He was my brother. He was a father. He was a grandfather. He was an uncle. And he had fought a valiant effort to live with his chronic kidney disease, then failure. Okay, well, now that I've gotten myself back together, let's move on and talk about GFR, what it means, and why it matters. I always like to take a moment and level set by explaining a few key terms. Let's talk about GFR, or glomerular filtration rate. In simple terms, GFR is a measure of how well your kidneys are cleaning your blood. Doctors use this number to stage kidney disease, meaning how far along your kidney disease is, and is also used to make decisions about treatment and transplant eligibility. Historically, GFR calculations included a race correction factor, which often led to underestimating the severity of kidney disease in Black patients. This meant that many Black Americans were diagnosed later and became eligible for transplant much later, if at all. In recent years, medical societies have moved to remove race-based adjustments from GFR calculations, but the impact of these policies is still felt today. It's a reminder of how clinical practices can unintentionally contribute to health disparities. That's why we must remain vigilant and advocate for equitable practices in medicine. Access to nephrology and specialty care. Nephrology is the medical specialty that focuses on kidneys. Nephrologists are the doctors who diagnose, treat, and manage kidney disease. But access to nephrologists isn't equal as well. Many patients face barriers like lack of insurance, transportation challenges, and long wait times to see specialists. In some areas of the country, there simply aren't enough nephrologists. These barriers can delay diagnosis and treatment, making outcomes worse. We must work to break down these barriers by advocating for better insurance coverage, maybe offering telemedicine, and also offering community-based screening programs so that people will know if they're at risk of having kidney disease. Dispelling myths. Well, here we go. I'm here to set the record straight. Let's dispel some common myths about kidney disease, dialysis, and transplantation. Myth number 1, kidney disease only affects older people. Fact, kidney disease can affect anyone, including children and young adults. Risk factors include diabetes, high blood pressure, obesity, and family history. Myth 2, dialysis is a cure for kidney disease. Fact, dialysis is not a cure for kidney failure, but it is a life-sustaining treatment. Myth 3, dialysis is a death sentence. Fact, many people live for years, even decades, on dialysis. Take my brother, he lived 8 years on dialysis. As I talked about, it's not easy, but with support from your family, from your doctors, and your community, and self-care, life can be full and meaningful. Myth number 4, you can't get a transplant if you're overweight or have high blood pressure. Fact, while these factors can complicate things, they shouldn't automatically disqualify you. Talk to your care team. There are ways to address these issues and stay on the path to a transplant. Myth 5, only family members can donate kidneys. Fact, many kidney donations come from strangers or altruistic donors. Defending families, resources, and navigation tips. Navigating kidney disease can be overwhelming, but you're not alone. Here's some of the steps and resources to support you. 1, education. Learn about your condition. Ask your doctor to explain your test results in plain language. Bring a friend or a family member to your appointments to help you take notes and to make sure that you understand everything that is being said. And if you don't understand, please ask questions during your visit or after by calling your doctor. Number 2, access. If you're having trouble finding or seeing a nephrologist, ask your primary care doctor or other provider for help with the referrals. You can also see if there are some places that offer telemedicine options and seek those out instead if you are unable to get in person. Number 3, support. Connect with patient advocacy groups. The National Kidney Foundation offers resources, peer mentors, and local support groups. And 4, financial assistance. Programs like Medicare cover dialysis and many transplant-related costs, even if you're under 65. Also, there are charitable funds that can help with medications, and travel expenses. Demanding justice, advocacy for equity. Justice means fighting for a world where everyone has a fair shot at health, regardless of insurance, race, income, or geography. We must advocate for policies that eliminate bias from medical decision-making and that ensure fair organ allocation and timely access to transplant is there for all. We need robust community outreach and education to encourage donation and offer support to families in need. Get involved. Call your elected officials. Join advocacy campaigns. Share your story like I'm doing today about my brother Lennard with all of you. Every voice matters in the fight for equitable care. National and state resources. So here are some websites or places that you can look for in order to help you navigate if you or a family member has chronic kidney disease, kidney failure, or trying to understand about dialysis or renal transplants. The National Kidney Foundation is located at kidney.org, and it is a place where you can find education, resources, and support. The American Association of Kidney Patients, AAKP, is located at aakp.org for patient advocacy, webinars, and peer support. The United Network for Organ Sharing, UNOS, gives you information about the transplant waitlist and also offers support. The Centers for Medicare and Medicaid Services, CMS.gov, gives you information about coverage for dialysis and transplant services. State kidney programs. Most states have programs to assist with transportation, medication, and finding transplant centers. Please contact your doctor or your state health departments for further details. And local support groups. Many hospitals and clinics, even in your own town and cities, may offer monthly meetings. So ask your care team for referrals or just search on Google. Conclusion. Today, we've looked at the real impact of kidney disease, including the disparities that hurt minority families the most. We've honored my brother's journey. We've defined key terms. We've dispelled myths, and we armed you with some resources. Remember, knowledge is power, and community is strength. If you or someone you love is facing kidney disease, you are not alone. Reach out, ask questions, and demand justice for yourself and for your family. Together, we can dispel myths, defend families, and demand justice. Thank you for joining me for this very personal episode of Justice Rounds with Dr. Jamel. If you know someone who would benefit from it, please like and share it and subscribe to my YouTube channel at Justice Rounds with Dr. Jamel. I hope that you would share it with someone that you think needs to hear this information. Until next time, stay informed, stay engaged, and keep fighting for justice. Bye-bye.